Hey, this is Dr. Scott Hoar from Alcoa Chiropractic Center in Alcoa, Tennessee. Today I wanted to take you guys through the Kinetisense 360 and how we use it in our clinic. Specifically how we're going to use a progress exam where basically we've completed an initial course of treatment with a patient so they're not in as much pain as when they first came in. And then we want to see, well, where do we go from here? And Kinetisense has actually launched a new aspect to their program where you can actually put corrective exercises in the program and then give communication and feedback with the patient. So I want to take you guys through that because that is super sweet and we're really enjoying it. And you can tell our patients, it's clicking with our patients more, where it really helps with kind of buy-in with what we're saying. You have more retention and really just better results with the patients because they know what they're doing. So I'm going to take you through all of that today and exactly how we use it. So this patient, he is a delivery driver, and so he's lifting packages. He's driving in trucks all day long, and you can see he actually presented with mid-back pain, is thoracic pain, and it's a recurrent thing with him. He kind of has ribs that pop out from time to time, and his most recent one is lasting for a few weeks, and it is not getting better the way they do in the past. So that's how he initially presented for care. Now he's had about 7 or 8 chiropractic visits up to this point, mainly doing chiropractic adjustments, and then now it's time to see his progress exam. And you can see his cervical spine range of motion is perfect. Cervical spine extension, left and right rotation, perfect. It's exactly the way we want to see it. So that's not necessarily something we need to focus on going forward. Spinal flexion, kind of thoracolumbar flexion, beautiful right there. That's exactly the way we want to see it. Extension of his spine, that lean back. We got that nice C shape. That's exactly what we want to see. Nice and limber. Now we look at the lunge, the ability to have stability and control while going through a complicated movement like a lunge while maintaining upper body posture. We want to see, can he do that? Looks like on the right side, it's pretty darn good. He's not experiencing any pain or discomfort during it. We look on the left, same deal. Looked a little slower to me, but nevertheless, not a problem, no pain. Now we're going to look at shoulder abduction. So this is one of the main ranges of motion. You can see the AMA wants 180 degrees normal range of motion for abduction. And when this patient went through it, he did not get the 180. In fact, it's a little bit closer to 160, 163 degrees. Now, this is noteworthy because while this is not a painful range of motion, and let's be honest, there's many people that have much less ranges of motion than what we're seeing here, that is a good 20 degrees less than what we want to see. And the compensatory nature of the body, when your shoulder, when your glenohumeral joint does not move with the flexibility it needs, that opens the door to additional strain and stress on the thorax, the ribs, the thoracic spine. So we're going to go back to that shoulder issue later. We continue with the assessment here to make sure balance is good on both sides. And really, he's knocking it out of the park here. He's pretty darn stable. You can tell there's not excessive stability or wobbling or loss of posture during the balance. So I don't think his balance is the biggest problem out there. So that's really the main thing. It was the shoulder range of motion on both sides that was really a limiting factor. And in my recommendations for his long-term health, what I'm going to recommend he does is really get better thoracic flexibility. That's the upper part of your torso, as well as shoulder flexibility, in particular abduction and flexion ranges of motion. I don't think he has the range of motion he needs, and I think that's opening the door to these recurrent rib subluxations. So you can see the corrective exercises to correctives that we're going to add to his protocol now, where we're actually going through the Kinetisense system. We need mobility, we need level 1 or 2, and we're going to focus on the shoulders. So this is me going through, well, do I want to do this exercise? Do I want to do that exercise? And Kinetisense has put a lot of time and effort into building up their library where they have a great number of options. And I can sit here and look through them, see the ones I like, see the ones I don't like, and then I can just click the box right there, and then that will include it into our patient's recommended protocols. See, I really like this one, that overhead shoulder mobility. Not too many exercises get a passive full range of motion in the glenohumeral joint, so that's definitely one I want to add to his plan. Here we go. And then I like threading the needle because you get that thoracic flexion and extension rotation. You get both ranges of motion from a partially weight-bearing position, which I think makes it a little bit more effective, so I'm going to recommend that one. So here's his 3 exercises that I'm recommending for right now. I'm going to go in there and alter the reps and sets as I see fit. And then we're actually going to have a start and an end date because there's going to be communication with the patient. Even if the patient does not come into the office, I want communication lines with him about his progress and his exercises and how it's going. So we're going to put, I want 3 times a day for these, or I'm sorry, 3 times a week for these exercises. And I'm going to give him some specific instructions. So you can see I sent the invitation to him. He downloaded it in his app on his phone. He has set it all up. He can send me messages at any time. And that's exactly what we want, right? We want feedback from the patient. How's it going? What do we need to alter? Do I need to change any of his protocols? This Kinetisense system gives me the ability to do that back and forth. So I love that they're able to have the Kinetisense system. They not only have the corrective exercises, but they also have the assessments that we found limitations in right in the palm of their hand. So if their wife or a family member asks them about their results, they can show them right there. So you're not going to get anything better as far as patient education. That's going to lead to better outcomes with the patient and better retention with the patient and better referrals. So this was Dr. Scott Hoar from Alcoa Chiropractic Center. Thanks, guys, for tuning in. Leave a comment below, hit the like button, and check out Kinetisense if you want this sort of system in your office.